get your body moving. Then the other component is social media. It's like you're seeing things that might not actually be true, that are staged, potential misinformation or disinformation.
No, I'm gonna do something funny.
Undue stress on individuals. People will say when they take a break from social media, they feel much better. Me, what was your favorite class in school? Gamers, health. Me, why? Gamers. Gotta get that extra health after I got shot in the head.
Okay.
I really do like in games where they incorporate the ability to heal yourself, the ability to use different medications. There's a lot of games reacted to that have a lot of health components.
Out of grass.
Definitely check that out.
Spunky, that's what I
And I think this health bag's gonna.
I'm an animation.
See people that get shot in the head.
Spunky,
and
spunky, spunky.
missing. The likelihood of survival is pretty low. People do survive, but not necessarily.
But when he attempts to say you monkey, I like, nah, bro.
A lot of times we see people get shot in the head and they might
I say, Bobby.
donors for other individuals. We live in a video game, NFS, when I push them off a cliff to check if they have a health bar.
By the way, I need the wrong one.
Push somebody off a cliff or fall off a cliff, it's going to be probably a big fall, because if it's a cliff, you're referencing something that's quite high. So the likelihood of survival of something that's that high is probably unlikely.
Wait, is it big? Can I
change? But, you know, we see people that come to the emergency department with balls maybe anywhere from 10 to 30 feet, and it's a major trauma. You have to be really careful. And we're going to do a head-to-toe survey, A, B, C, D, E, and make sure you're okay. Breathing and breathing. Okay. EA Sports, get in the game. Breathing apparatus machine. This could be a CPAP or a CPAP. It's most likely a CPAP, which is a continuous breathing apparatus that people use at home, typically for sleep apnea. When
what do I do it?
And they're in respiratory distress by the EMS system, but you don't need to be intubated. They'll put you on CPAP, okay, continuous. But most of the time we'll switch you over to BiPAP, meaning it's two different phases. Going in with this expiration. Bone joint gets dislocated. Normal people get treatment from medical professional, aka me. Gamers, snap it back into place, right? It's like snap, put back together. It looks like maybe a wrist dislocation or a finger, hard to tell from this view, but sometimes people dislocate something and then pop it right back in. I will say, getting a dislocated joint back into as soon as possible will have a bad outcome, because you have now reduced the risk of it being out, the stress on the joint itself, the muscle tension, the swelling, and then it actually prevents more long-term damage of like arthritis. But we see this a lot, and we have to make sure that dislocated joint that they actually didn't also fracture something. Because I've been in a situation where somebody has a fractured dislocation and part of the
no, you're not meant to do that. No way. Oh, no, SpongeBob. What are you doing, man? Bruh, you broke it. See, that one I love you, the kitten. Don't worry, we'll fit back to normal. My body is stuck there. No copyrighted music. Oh crap, oh fuck.
Nobody, a 6-year-old me, after putting on a toy stethoscope. Let's go practice medicine, okay? I mean,
my God, you gotta do that freaking copy your bullshit.
And actually, some of those stethoscopes do work. So, what is a stethoscope?
A tiny
device with a small diaphragm on it that allows us to hear different sounds that are going on the inside. Literally, you can also hear sound. You see people who are trying to rob banks and they put stethoscopes on the thing so you can hear clicks. Yes, it makes the sound louder, and this way you don't have to be so close and put your ear on somebody's chest. But you can literally put your ear on somebody's chest and hear what's going on the inside. Do I wear one? Yes, I actually use one at work to listen to lung sounds and listen to heart sounds.
Don't lie to that.
Nobody, my stomach during an exam, screaming. This individual is quite intense at the moment, screaming at the game. Maybe during an exam your stomach is growling versus in a lot of pain. I know when I do an exam on somebody's abdomen, I'm pushing in all 4 quadrants, right upper, left upper, right lower, left lower, different organs in different areas. I'm nice, I won't push very hard, I will go to the spot that's hurting you the most last, that way you know what's happening. And no matter what, when you push on somebody's abdomen, it is uncomfortable. I'm trying to
can you get off there?
reproduce discomfort culprit. Why is so then I can figure out what organs underneath might be causing an issue. You know, right upper quadrant.
What am I trying to?
gallbladder,
Yeah,
your
you get a
liver, part of
picture.
your stomach, part of your pancreas. Could be your intestines as well. Then, you know, right lower quadrant, that's where your appendix is, that's where ovaries are, that's where your colon is. Things to think about. Babe, doctor's orders. Trianal.
Oh, Mama!
This medication is like the exact same medication as Furanol, which we use as like a headache medication for pain. Don't believe your significant other when they say this is the doctor. This is really funny though. When you don't know what one of the vital organs are, what the hell is the big blobby thing? It's a cool image. You can see the cerebellum in the back and you see the cerebral cortex. Most docs, we don't know how to
Okay,
read
I got offline.
to the radiologist. Vital organs, what are they? Your heart, your lungs, your brain, your kidneys.
How is that Kenny
Your
walking
child
out?
Play-Doh is this
Leo.
fast. Oh my god. The leaf is labeled as non-toxic. A lot of times in the emergency department, we don't get kids
Okay,
too
get off
often
there.
with just randomly swallowing things or putting them in their mouth. But usually it's ears and nose where we actually see things get lost.
The dog
in, and we
never
have to
can see the
figure out how to
bullshit.
get out of there. You can't have
Boing.
a mental
Boing.
illness if the psychiatrist doesn't accept your insurance. Oh my gosh. A lot of hospitals,
No one
as
can.
well as doctors that have offices, they will take patients without insurance, but they will come up with a financial plan to figure
You know what?
out.
Fuck this shit. Okay, I'm not gonna say it anymore. Kenny, you up there? Sorry, I can't see him. Get off.
Then yeah,
Maybe what?
hi. If you have a conversation
Making me
with the
pull up
partner
there.
of the company, there are options that they can do.
Oh shit.
ADHD is a superpower. ADHD
No,
is
it's
an
my-
attention
oh my God, you
deficit
fucking bitch.
slash hyperactivity disorder that is the most common neurodevelopmental disorder of childhood, and it has to do with
Well, what
short
happened?
attention, impulse
That
behavior
didn't
issues.
cut themselves.
Some people can't focus, and so they get medication they can focus. The deceased patient
What
passed
can I
away
do?
while masturbating. He died
I
having
think
a
rabbit
stroke.
can
Oh
split
my
to
gosh.
two.
Little play on words, okay, I get it.
I
Not
mean,
cool.
split
Could you have a
into
stroke
two.
if you were masturbating?
Okay, man, that made no
Yeah, you
sense.
could. If your blood pressure goes up, increasing weird blood flow to the brain, and too much physical exertion. I see more commonly
Man, what is your
people with
dance
stroke or
cool?
have a heart attack during sexual intercourse.
Oh, my foot!
Actually, my left eye, my
Oh,
right
let me show
What
you.
happens all the time. I will ask you a
rabbit's
million
foot.
questions when somebody comes in with eye problems related to. Do you have two images? Do you have double vision? Do you have blurry vision? There could be an infection over the eye. Sometimes this also could be like a cataract.
I got
where
10
the
years of
cornea is hazy and needs to be
survival.
removed. If you start having
Worry,
blurriness or any visual changes to your eye, get to the hospital immediately.
Survive. Ha ha ha. Get off my phone.
Get it done.
Did the push up then right now?
Introducing the sports snack for every occasion, with refreshing flavors, a smooth texture, and bold taste. This fruit blend has just what you need to keep the fun going. New Go-Go Squeeze Active with electrolytes. Squeeze out the best.
We're on with what's new this morning.
What's happening now? And what's next for you, LA?
Get what's new now.
And next at 4, 5, and 6, right here.
Right here
Alright.
at 7A.
I didn't push it.
All morning long.
Eyewitness News Mornings and GMA. Size helps you find gifts.
There you go.
Plus fun.
Okay, bye guys.